members of these recognized tribes and their descendants are eligible for care provided at either the federal, tribal, or urban health system. Collectively, the Indian Health Service provides a pretty comprehensive health service delivery to 2.56 million of the nation's estimated 5.2 million American Indians and Alaska Natives. And that's important to keep in mind because if you're not aware, nearly 70% of our Native populations live off the reservation and live in urban areas. And so that's important to understand and know that when I talk about Indian health, at least in our area, I am looking at both the urban and a small portion of the federal, but also the tribal health centers as well in Wisconsin. So it's important to keep that in perspective. The United States is portioned out into 12 areas, Alaska being one. That's not on this map, but just so everyone knows, Alaska is its own entity. And then you have, areas like Portland, Billings, Great Plains, California is its own. Phoenix, when we talk about Phoenix, when I talk about numbers about Phoenix, I'm talking about the state of Arizona, Nevada, and Utah. When I talk about Albuquerque, I'm talking about New Mexico and Colorado. Navajo, of course, is its own, as well as Tucson. When I talk about Nashville, you can see Texas, Louisiana, Arkansas, Missouri, Illinois, and east of those states, everything east to the East Coast is all Nashville area. So when I start looking and breaking down numbers, it's important to keep this regional map in mind and how numbers are looked at and discussed here. So the Indian Health Service offers daily updates, and what I've done is looked at the Indian Health Service's update as of 36 hours ago. From left to right is the areas, the 12 areas, as well as the number of tested, the number of positives, and the number of negatives. When you look at the totals on the bottom, you see positive and negatives. They certainly don't add up to the total number. That's because the difference in that number are pending tests. So they have not been, the results have not been released as of yet. So when we look at Alaska, you can see in the table to the right-hand side, the change in positive cases. So you can see in Alaska, there's been 2 new cases in the last 7 days, the last week. Albuquerque with 69, Bemidji with 115. As you go down, you can see Nashville has a change of 177. Navajo has a change of 819, Phoenix 406. And so since a week ago, almost
doesn't matter.
1,800 new cases. That next column where it says test. And so test indicates the difference between the number of tests that were done a week ago to today. And you can see that the number of tests, almost a little over 27,000 tests have been conducted. So every region, everywhere, there's certainly been a significant portion of testing that's ongoing. On the third column, percent change. So that's the percent change of new cases over the last week, and you could go down and see where the high numbers are. Albuquerque has a 11% change. Bemidji has 108, nearly 108% change. Great Plains 33, Nashville 41. Navajo, although their numbers are high, it's going to make it harder for a percent change to occur, but just it's one piece of information when we start looking at trending and outward views on what's going on. Phoenix has a 40% change since a week ago, and Tucson has nearly doubled its numbers. So on the very far right-hand side is the percent positive. This is the percent positive of tests, number of positive tests over the total number. And you can see that there are a couple areas that are still very significantly high. Nashville is one, Navajo is another, Tucson with its doubling, and you can see California as well as the Bemidji area, the percent positive. So things have changed, things are developing, and I think it's important to know that when we start looking at Indian Health Service, that includes the federal sites, tribal and urban sites, that the amount of testing that is occurring, it's very widespread. I wouldn't doubt if every agency has done their share of testing. And I think the latest numbers that have come out that IHS is reporting is that collectively the entire system is testing at a higher per capita rate than all races combined. So right now, these ITU systems, federal systems, tribal and urban, are testing 62 people per 1,000 compared to 43 people per 1,000 of all races in the United States. So that's pretty significant. And I think that's important to note, is that testing is occurring throughout our entire system. When we start looking more regionally to Wisconsin and the Midwest, you can see to the right-hand side, Michigan, they have a number of tests that are going on. They're 55,608. That's a 4.9% increase from a week ago, and roughly about 2,600 new cases of coronavirus have been confirmed. In Illinois, they've had an 8.1% increase since last week, and 42, nearly a little over 4,200 new cases in that time frame. Illinois has had a 13.8% increase, which is pretty significant, and they continue to have, on a regular basis, high numbers of confirmed cases, nearly 14,000 new cases since a week ago. And then Minnesota has had a 27% increase, probably the most significant large jumps that have been ongoing for the last 3, maybe 4 weeks. And they're at nearly 4,800 new cases in the past week. Here in Wisconsin, we're almost at 23% increase, a little over 3,000 new cases in the last week. And that can certainly be contributed to several reasons. One being a larger effort of the state and federal systems providing National Guard outreach to increase and boost our capacity to provide testing. So, but that also means more testing indicates we'll be able to find more cases, which has been occurring over the last week. So in the Bemidji area, I'll be looking specifically at Minnesota, Wisconsin, and Michigan, and more detailed to the tribes and the representing counties that they reside in. So you can see Michigan with its 12 tribes, each reside in a county. Each of these sites do not specifically and officially have determined cases. So looking at the Michigan Public Health website, looking at the number of cases per county, you can go down and see the majority of the tribes have had no new cases in the past week, which is remarkable, which means that not only the number of cases, but the amount of testing that's occurring is not resulting in a case. So that is good news for Michigan tribes. Probably the most significant is Kalamazoo, Cass, and Isabella County, and that's more in the central and central part of the state and the southern, southwestern part of the state as well. Now Kalamazoo, 814. We know that cannot be all tribal members, although there's no official number being reported. It's certainly possible there could be cases, but there's no way to know for sure. So the Michigan Public Health Department's estimates that there's nearly 60,000 cases. 60,000 tribal members identified in the state, and although they don't break it out definitively, the number of cases in Michigan is less than 1%. So unknown to how many natives are currently afflicted with coronavirus. In Minnesota, we have 11 tribes, and as you can see, the tribes and the counties that are represented, the number of cases. Now, this is not to say that there, let's say for Red Lake, that's not to say there's 13 cases of tribal members. That is to say there's 13 cases in that county. And the change that has occurred from a week ago is by four new cases have been identified in Beltrami County. And as you go down, you can see the majority of the tribes, their numbers are relatively flat. There's only one area, and that's Prairie Island, in the county that they reside in, that the number of cases are actually going up, and that's noted by 8. And Goodhue County, they've increased their cases by 22, and that I is not a 1; it's an I to represent that it's increasing. In Shakopee and Fond du Lac, the number of cases are decreasing, and as of yesterday, there's been no official confirmation of tribal members afflicted with coronavirus at this time. Now, the Minnesota Department of Public Health has registered 176 tribal members with coronavirus. That's 48 new cases from a week ago, and that's a 37.5% increase from the week prior. So, as 48 new cases may not seem like a lot, when you look at the percent increase of almost 38% from the week prior, that's pretty significant, and it really goes to show that the native population may not, a greater percentage lives off reservations and in urban settings, which is understandable, but at the same time, it's reservations and urban settings. We're definitely seeing a lopsided number of cases outside of the reservation. And so that's good that reservations aren't seeing the numbers, but I think it shouldn't be a sense of being cleared from the virus. I think it's just important, the efforts that the tribes are doing to protect their individuals on their respective reservations, and it's important that they continue those measures to do so. So back here in Wisconsin, we have 11 tribes, and After doing some more in-depth research, we do have, let's say, Stockbridge and Shawano County. Shawano County has 41 cases now, 7 new since the week prior. And they've announced officially that they've had their first case. Respective to Menominee, and I do want to speak and apologize for misrepresenting a number I spoke to last week. And it's important that I do get the information right, and I want to respect Menominee and its tribal sovereignty. They have officially come out on their tribal website and confirming their second case on tribal land. With Oneida, they have more recently announced the number of cases that are impacting the Oneida Nation. They have reported out 39 cases as of from the Journal Sentinel Online's today's article, 39 cases in Oneida. Ho-Chunk, through this article as well, has reported out of their base in Black River Falls, 13 cases. Lac du Flambeau has reported 1, as well as the Coudray 1 as well. Bad River, Red Cliff, St. Croix have not reported any cases, and Potawatomis have reported no cases to date. So looking at the number of cases that are being reported out officially to what the Wisconsin's Department of Health Services data set shows as of yesterday, there's been 187 cases in the state. 35 new cases as of a week ago, and that's a 23% increase from the week prior. So the numbers are significant, and the amount of testing that it's occurring within the state is important, and I think it's important that each state and their respective tribes continue their efforts in protecting their tribal members, because it's going to be important moving forward. The coronavirus isn't going away. It won't go away anytime soon, and it's important that everyone maintain a level of caution and protection of not only self, but your entire family. And as a result, that includes your respective reservations as well. So looking at Wisconsin's information, as I mentioned, Wisconsin Department of Health Services have reported 186 cases. That's 35 new ones, 23%. But sadly, 3 new deaths have been reported since last week as well. What's important to realize in this graph that on the far left-hand side, as you go down, looking at the different races, there are 2 categories, unknown and multiple or other races. And my only concern is that these 2 categories, which have a significant portion, almost a quarter of the state cases, there's no race identified, and I suspect that there are natives in these 2 categories. It's just no way to know how many right now. Looking more broadly across the state of Wisconsin and using Illinois as a comparison, as of right now, all 72 counties in the state of Wisconsin are reporting at least 1 case. That changed last week going into Memorial Day weekend. The number of cases from last week to now, an increase of the number of percent positive is 7.2% of cases have resulted in being positive. In Milwaukee, there are 6,748. That is the largest confirmed cases in the state of Wisconsin. From 1 week ago, that's a little over 2,500 new cases. And the week prior, I put in another number there that says 1,000. That was the week before. So 3,500 new cases over the last 2 weeks, the most in the last week alone. Brown County, 2,285. They've essentially flattened out the number of cases that they're reporting out. Dane County is decreasing, at least trending downwards. Kenosha total is at 1,000, but in the last week, the number is decreasing as well. Same with Waukesha. The one concerning area that's being regarded as maybe another hotspot here in Wisconsin is Racine. They're almost at 1,600 cases, and what we're seeing from the week prior is 464 new cases. That's up from 330 the week prior. So when we start looking at numbers, it's hard to just look at it day to day to day. But if you start looking at numbers and group and trend them over time, you can see how things are progressing or receding over time. So in Wisconsin, Milwaukee is definitely an area of concern, as well as Racine. In Illinois, you have McHenry County and Lake County. Those are the two northern counties that are just below Kenosha. And just Lake County alone has 7,800 cases. That's more than Milwaukee total, and that's just one county in Illinois. When you go south of Lake County, you get into Cook County, 30,000. And when you get into Chicago proper, you have 43,000. So there's a huge concentration of cases, and it's all in the Chicago area and the northern suburbs and counties of McHenry and Lake, which are just adjacent to Wisconsin. So definitely a lot of overlap, and more than likely a lot of commuters back and forth across state lines. So it's important to keep in mind and keep in context what's going on in your area or even in your region. Bringing it back into Milwaukee, over 6,800 cases, 264 deaths have been reported to date. The center map, you can see all the yellow circles. The smaller the circle, the smaller the number of cases. The bigger the circle, the more cases. And you can see just south of the highway, on the south side of Milwaukee, you can see just huge, dense areas of confirmed cases. A lot of overlap, a lot of concentration, and the majority of the new cases that are coming out on the south side of Milwaukee. And that is exactly where the Gerald L. Ignace Indian Health Center is located, is on the south side and pretty close to being in the center of all of that. So I wanted to draw your attention to the left-hand corner, the number of new positive cases per day. You can see that as the months have progressed, and to the right, you can see that the number of cases have increased, and that's twofold. One is all the community health centers have contributed a pretty significant effort in participating in the capacity to test, and our agency is certainly one of those. But in addition to that, and I don't know if people have realized this, but the National Guard was also brought into Milwaukee to increase that capacity as well. And so there were several sites that were set up, north side as well as the south side. And so they've been present for about a little over 2 weeks now. And you can see that their impact has greatly contributed to diagnosing new cases out there in the community. So the National Guard has also been quite helpful in raising our capacity to test and confirm new cases. On the left-hand side, in the confirmed case count by age group, So it's been several months into this pandemic, and in the very beginning, it was viewed as mainly our older communities, our elders, were mainly affected. And so the majority of the numbers were more of the 60, 70, 80, 90 age groups. But as time has gone by, the number of diagnosed cases are now becoming more of the younger age group. And we're talking about the 20, 30, 40, 50 age groups. And you can see that by this graph, that the majority of cases, at least here in Milwaukee County, is in that 30-year-old age group. And so you have this bell-shaped curve that was not how it was in the beginning. It was skewed to the right, but as time has gone by and more testing has occurred, now we're getting into more of the bell shape. And I suspect we'll probably end up going, at the beginning it was to the right, and now it's probably going to go to the left, and we're probably going to be seeing a lot more younger people with cases. Now, that's one part of this. The other part, if you go straight across to the number of deaths by age group, you can see where that skewed number, where you have 60, 70, 80-year-old age groups being the most dramatically affected by this. Once you start getting into the lower age groups, you start seeing fewer and fewer reported deaths as a result of COVID. So I guess you could look at this good news, if there is a good news, that if a younger individual was to get COVID, there is a very good chance that individuals will have mild to moderate respiratory problems, but won't require hospitalization, and certainly won't have a bad outcome as a result based on what's going on right now. If we break down Milwaukee County a little bit more, you can see the age group, the racial breakouts throughout the city. As a couple of weeks ago, this was not the case. Hispanics and Latinos have outpaced all other racial and ethnic groups. So Hispanics and Latinos at 2,200, African Americans 2,100, non-Hispanic whites 1,400, and as you go down, and to the right, there are now 26 cases confirmed in Milwaukee. That's up 10 cases from the week prior. It still represents a small portion of the overall demographics in Milwaukee County. But again, this is 10 new cases from a week ago. And I'm a little concerned regarding that, because that's the biggest increase that I've seen here in Milwaukee since this pandemic started. And it's going to be important, not only now, but for the next summer months that are coming. There's going to be a greater need to assure protection, not only for our youth, but also for our elders. And so as we know about Indian health, we know that there are long storied health disparities, health status of natives, lower life expectancies, disproportionate disease burden exists. We know there's health disparities, not only to access to care, but also higher proportions of individuals with diabetes, cardiovascular disease, cancer, increased socioeconomic issues, as well as poverty and low income. So these all impact our communities, our Native communities, and how we can overcome the concern that everyone has of what this could do to Native families and Native communities as a whole. As I've mentioned in previous town halls, the major risk groups, and this obviously affects all of us. Individuals that are over 65 and older. We may have loved ones, elders that may reside in nursing homes or long-term care facilities. We all may know a family relative, brother, sister, aunt, uncles, grandparents that have underlying lung disease, whether it be moderate or severe or poorly controlled asthmatics. I talked about cardiovascular disease in the Native community. There's certainly our share and people with underlying heart attacks, congestive heart failure, even mitral valve replacements, bypass surgeries. These are all serious cardiovascular diagnoses. Also, people with who are immunocompromised, either through treatments, medications, cancer treatments, people with newly diagnosed cancer, obesity, certainly with the BMI over 40 is a concern, and poorly controlled diabetes, kidney problems, liver problems. These are all high risk individuals, and unfortunately, these are also high disproportionate disparities that we have as Native people compared to the general population. So it's important that we look to care for one another, not only in providing comprehensive care, but also looking at protecting, especially at this time. And probably the biggest take-home message and the cornerstone of public health is certainly washing your hands, using soap and water, washing for 20 seconds. If you don't have soap, if you have hand sanitizers, then it can be just as good. Not as good, but good in disinfecting your hands. And probably another big thing is avoiding touching your eyes, nose, or mouth, especially of an unwashed hand. So these are all important things. Obviously, covering of yourself, and that may be a covering of your face, or a more medical grade protection is just as useful and more protective than a covering itself. For our efforts here at the Gerald L. Ignatius Indian Health Center, we offer safer at home kits, whether it be personal hygiene or cleaning kits, which contains laundry detergent and bleach, soap, hand soap, bars of soap. We provide those. Just call us and let us know when you'll be coming by, and we'll be more than happy to offer either one of these kits. We've offered to support our communities, their families, and their young ones during this time. Everyone is at home, no school, and I'm sure people are running out of ideas to help their family kids pass the time. We do offer kits, so please look to us to be able to offer something for you for this summer, and we could certainly help out in that regard. Our Circles of Strength addresses domestic violence and sexual assault. Our programming supports and victims. We have our phone number here listed, 414-383-9526. If you are someone who is afflicted by domestic violence or sexual assault, please don't hesitate, and we will be there to help support and guide you during this difficult time. So please feel free to call. And most importantly here, if you do have concerns about not only your exposure risk, or whether or not you have symptoms, that may be either a fever, a cough, a chill, muscle ache, short of breath, sore throat, headache, fatigue, muscle aches, nausea, vomiting, diarrhea, loss of smell, loss of taste. These are all signs and symptoms. So if you're concerned about your exposure risk, or you think you may have been exposed, or you may have a symptom or two or three or multiple, feel free to call us. Again, our phone number is listed here. Feel free to call us. We will be more than happy to offer an evaluation and assess your need to be tested. And we would probably schedule same day to be able to offer that here at our clinic. So we provide testing anytime. So if you're concerned about your exposure, please don't hesitate in calling our clinic. We'll be more than happy to offer that testing. Just a quick reminder, 20 seconds, and how to wash your hands. May seem kind of rudimentary and basic. You've been doing it all your lives. But if you look at each one of these circles and you actually say them out loud, it will take you about 20 seconds to get through that. And so it's a step-by-step. You get through all the crevices of your hands and your fingers and behind and the front and the back. By the time you're done, it'll be 20 seconds. And so it's important to use soap and hand sanitizer. The other big items, of course, is avoiding big crowds, avoiding contact in big groups, social distancing. And one of the biggest things, if you are feeling sick, don't go to work. Let your employer know and look to get tested. And if that means looking for a place to be tested, certainly come to our facility. We'll be happy to do that for you. This is our crew. This is our frontline crew. They're there every day, 5 days a week, and we provide testing. So call us anytime, set up an appointment. We'll walk you through it, and we'll be happy to offer our assistance and any other health services that you need. So with that, I'll turn it over to you, Jeremiah, and Mark for any questions.
Thank you, Dr. Ignace. Right off the bat, I'm going to give us a question and give you a question that I guess Pat's Glick on the back a little bit. So an attendee's question was, what's so impressive about Glick is your service to all of Milwaukee community and not just the native population. Do you have any demographic info about the people that we are treating at Gerald L. Ignace?
So, we see, we have a user population of over 8,000 individuals. Almost half of these are native, and native individuals, not just from Wisconsin, but also throughout the Midwest and the entire country. So last time I checked, we see over 75 different tribal members from across the country. So the other half of our user population is a pretty good representation of the South Side. So the South Side made up of Hispanic and Latinos, African Americans, non-Hispanic whites, Asians, Southeast Asians. So we have a pretty good mixture, but the majority of our user population is native based.
Just checking in, Dr. Ignace, this is a native to native conversation, and kind of what's going out there on the street is quite concerning. One of those being, if anybody has children in school, MPS or other areas, you know that a lot of our schools have chosen to feed families. And when those programs first started, a lot of lunches were left at the lunch sites. And now lunch sites are running out of lunches quickly. I think the economy is starting to really take a toll. And along with that, families are feeling a lot of stresses I know, for example, here in our house, we took someone in within our own family, and it wasn't related to COVID-19 directly, but because of the pressures that the family they were living with, they just were starting to get after each other. So I was wondering if you could share a little bit about what you have there at the Indian Health Center here in Milwaukee as far as mental health services to help folks kind of figure out and navigate these very high pressured waters, especially now in a time when people are being asked to return back to work.
Yeah, without a doubt, this is the pandemic has impacted every family. And I think, as I mentioned in previous discussions, that the impact has reached every social demographic and every racial demographic in its own ways. And in particular, it certainly can impact us as Native people much harder because we're dealing with multi-generational living situations where we may be looking at family members that may be the sole income for the household of maybe 5, 6, 8, 10 people. And so the times are going to be tough right now. There's 41 million people that are currently unemployed. And I'm sure Natives are certainly part of that. That's impacting not just today, it's going to impact tomorrow, next week, next month, probably the next 6 months. And so that comes with its own stress. Not only its physical stress, but also its mental and emotional stress and impact that may have on families. You had mentioned food. Times are going to get tough. We have worked with other Native organizations within the Milwaukee Milwaukee community, and the Indian Community School allows family meal drop-offs as one of our sites in the city. So families from the Indian Community Schools can certainly pick up meals for their kids there. Our program at our clinic, we offer meals to our elders. So we do kind of a run and drop off for meals for our Native elders who don't have the means or the ability to provide meals for themselves on a regular basis. So we do provide food on a very limited basis, food services to our Native elders. But as far as mental health, our mental health department is operational. So I talked about the Circles of Strength, but that's also the phone number to the mental health department, behavioral health department as well. So if you're looking to reach out or a family member who's impacted during this time, we are taking individuals. It may be a slow process. We're trying to effectively bring people in to limit their exposure as well as minimize exposure to the agency. But we are taking new individuals on. And so as difficult as this time is and will be for the foreseeable future, just realize that we would be a good outlet for people to come and see and address or even discuss or just have a person to discuss their concerns that are ongoing right now.
We did have a question regarding kind of just the spread of the virus and then, how it's being kind of viewed in the public and via news outlets. And there was a question saying that the virus is spread or has been spreading more from face-to-face contact than by actual contact through surfaces. What do you think about that? do you see it as being one way or the other? More often than not, it's face-to-face. More often than not, it's services, or a good mix of both. And I know you've definitely harped on the washing your hands, cleanliness at home, at work, all of those things. So just to see what your thoughts were on that.
I think from a public health standpoint, the washing the hands, surfaces, disinfecting, cleaning, that doesn't change. I don't think it should ever change. In fact, on the CDC and every other public health website, you will see as being one of the principal cornerstones of prevention. That's never going to go away. Just like seasonal cold and flu, it's always been hand washing, soap and water, hand sanitizer, and refrain from touching eyes, nose, and mouth, because there's really only 3 ways it's going to get into your body. It's going to get in your body through contact from your eyes, nose, or your mouth. So when we talk about prevention and we talk about what's needed to be done, obviously to reduce your risk, not just wearing a face mask, because that alone won't prevent the transmission. You also have to look at protecting yourself, and that includes your hands, because that's really the only thing that's going to touch your eyes, nose, or mouth. So you need to do both. Without a doubt, you need to do both. As far as protection, you could use a covering. My only concern with that is you see this out in public everywhere you go. People will half wear their mask. They'll drop it below their nose. They will drop it below their jaw, or they'll bring it up above their heads. And at the same time, they're still using their bare hands to do it. Bare hands they've been touching everything, and then they touch their mask, and then they readjust and put it back on themselves. So if we're really looking at a concerted effort of maintaining a sterile field between you and the world, washing your hands is going to be, it has to be everything that you do on a regular basis every day. The mask can help, but we don't have masks that will provide better coverage, and that is a mask with a face shield. And that's what you really are really wanting to do if we're looking at the public as a whole. Without that, sometimes there's a need for a mask, without a doubt, and there's a need to wash your hands and being clean and disinfecting surfaces. So it goes hand in hand. It goes both. It's not one or the other, or one is more than the other. They have to go hand in hand to look at prevention.
Jeremiah, I'm going to ask you to help me out with this, just kind of an object lesson, I guess. It's something we talked about before we went on air, but I think one of the question about COVID-19 being spread through the air and the concern about that has really come forward in the last few news cycles. So my understanding, and I'm looking at some studies that have just been released about this, is if you're in the area when someone sneezes, there's about 100,000 droplets that are contained within that sneeze. And those droplets and the other stuff that comes out of our noses, their noses, when they do sneeze, that's going 100 miles an hour. And the range of that sneeze is about 19 feet. And I know you're at your computer and I can't back up, but I was just wondering if you could take 6 steps back, estimated at least, just so kind of we can see on our screens just how far that is 19 feet. And Jeremiah is just being put on the spot right now. But if you just watch your screen and watch him go back 6 steps, right, just kind of maybe 3 feet apart. Now, if somebody sneezes in that area and you're coming around in a grocery store or something, the active area for that aerosol that happened of someone has COVID-19, it's 14 minutes. That virus is going to be around for close to 15 minutes, and he's doing the right thing. This is why it's so important. Certainly those masks are to help protect the people that are around us, and now we know why you're wearing them. You could be, and I would like Dr. Ignace to weigh in here and tell us about, let's say, even if I just cough, because I just feel like coughing, it is springtime, it's that season, maybe I have allergies, but yet COVID-19 can exist in and with the allergies. But when someone says the word asymptomatic, and someone's in that store and sneezes, has that mask halfway down or whatever it may be, can you tell us what asymptomatic, what exactly is that?
So I mentioned previously about symptoms. So when we talk about people who have the signs or symptoms of coronavirus, so that includes someone who may have a fever, an ongoing fever, someone who's actively coughing. And I'm not talking the indiscriminate cough here or there. I'm talking about coughing like on a regular basis. Even being short of breath, having a sore throat, headaches, body aches, full-on joint aches, nausea, vomiting, inability to eat. Maybe they have diarrhea, loss of smell or loss of taste. Basically, I don't know if anybody's had the flu. I've had the flu. It's not fun, but it does make you feel like you've been run over. That's basically having full-on symptoms of COVID. Now, we know that that's in its more extreme form, hospitalizations and being in the hospital. There are mild forms, moderate forms, and mild forms. Now, this could mean, hey, I had a low-grade fever, or maybe I had a sore throat, and that's all I had. That's still symptomatic. So for people to say they're asymptomatic would have to be free of all symptoms. It can't be mild, it can't be one or two, because if that's the case, then you can say that, well, you have a symptom. Being completely asymptomatic means you're not coughing, you're not sneezing, you're not having a runny nose, you don't have a fever, you don't have body aches, feel right as rain right now, and everything is fine. That's being asymptomatic. So with that, people do have allergies. It's still springish time right now. A lot of rain, a lot of pollen, a lot of growth going on. So people can sneeze. People get postnasal drip. They do cough. So there may be sneezing and coughing ongoing right now that may not even be related to COVID. Not to say that there isn't, but again, if you're coughing and sneezing productively and actively, I wouldn't call, and if you're positive or turn out to be positive, I wouldn't call you asymptomatic. I would say you are symptomatic with coughing and sneezing, and you may even have a low-grade temp. So I think it's when we talk about asymptomatic, we're talking about completely free. I don't know how everyone is defining asymptomatic, whether it's mild nausea or loss of appetite with a sore throat. I guess as a provider, I call that having some symptoms, especially if you come up positive on that. So you had brought up, concerns about public spaces where people may have a cough or a sneeze. If you are in the general public, I think that's where, I don't know if people remember this, but about 10 years ago, with the swine flu that came out, with the H1N1, there was a huge public approach about coughing and sneezing in the general public, and that was using the inside part of your elbow. And so that was a newer, not a novel, but it was more brought to the forefront. If you're going to cough or sneeze, you do it in your elbow. And, even cough or sneeze inside your shirt if you have to, but if you're talking about that cough or sneeze outwardly, the best way to bring that that spray down would be to cough in your elbow or cough into your arm or shirt. So, being in the general public, being exposed, especially poorly ventilated areas, there would be certainly a concern about that aerosolized droplets that may be present. If you're wearing a mask, just make sure you wear it properly. And I guess one of the things that I notice a lot is in the public. So if you wear a mask, and whether you have gloves on or not, if you're touching everything in the general public and you have a mask on, wash your hands before you touch your mask. And after you touch your mask, wash your hands again. If you want to maintain as sterile as possible mask or covering, wash your hands before, wash your hands after. That would be the best way to maintain your face mask free of or at least to really reduce or minimize your transmission, is to keep your hands clean before you touch it and after you touch it.
So I wanted to follow up with that understanding. And there are people being called back to work. And within our family, at least, one of those folks works for a governmental agency. They've been off for a while, and now they got a call report Friday morning. The question was asked about, will there be any precautions around COVID-19, what to expect, what should they bring? And a relative was told, just report to work. So given that kind of environment, meaning just someone gets a report to work call, what is it that you would suggest to that worker who's told to report to work and don't worry about any kind of protective gear? We expect you to be on the job.
Mm-hmm. So I think, and this is gonna happen everywhere. I think as employers or places of business, trying to get back into a society of business again, some kind of new normal, there needs to be certain protocols in place and policies that each place of business has to have in place. So number one, they have to have a system to be able to assure that their employees are not only safe, but they're also a level of protection. And so what does that mean? Are they going to provide the hand sanitation? Is there going to be cleaning and disinfecting ongoing? Are there going to be screening of employees? And what I mean by that is not only a Q&A, do you have symptoms? Do you have a fever? Do you have a cough? But they're actually temperature checks as well. So doing a quick assessment as well as a temperature check should be a part of their new process. In terms of protection to the employee, is the place of business offering masks to their employees? And if they don't, I strongly suggest, if they are particularly exposed to the general public often, I suggest that they identify a place to be able to either purchase or get their hands on a mask. And I would wear it at work. And then when you're at work, I would definitely wear it when you are face-to-face encountering, talking to people, even as a one-to-one or one-on-two or in a small group session in a room, closed room, wear a mask. When you're at work, you need to look at protecting yourself. So if you're in an office, you need to look at cleaning, disinfecting, wiping down your keyboard, your phone, your headsets, your counter surface, your cell phones, your doorknobs. That goes without saying. So there's a new normal, a new level of cleanliness and disinfecting and cleaning. But for the individual itself, they should, if they're going to be at work and they know they're going to be in front of a lot of people, they should be wearing a mask at all times.
One of the other questions that I got, this one from one of my cousins that was talking about gloves. Our conversation kind of went like this. You know, this is native to native conversation. So excuse me for the insider kind of stuff here if there's any non-native folks watching. But I told him, yeah, he got his report back to work for at some point next week. And he said, I said, well, the kind of work you're doing, how are you going to protect yourself? And then he said, you know, I got all kinds of gloves, Mark. I got gloves that have gloves. I just got them in my truck. And if they tell me to wear gloves, I'll just grab a pair and that's what I'll wear. And whenever I see my supervisor, I'll put them on. And that's because we got stuff to do. You know? So I get it. But that points to one of those really kind of, it's an easy question, but yet it's hard to really talk about. And I think that's why you're here, to talk about that, is if someone's wearing gloves, will that protect them? What precautions do they take? Because they say, hey, I don't got time to wash my hands. I'm going to wear gloves, and I'm going to grab any gloves I got in my truck. What can you talk to that point?
So, you know, gloves would be useful, especially when you know you're going to be in an area that either you know is contaminated or there's just high flow on counter surfaces, touching, so forth, or just high level of protection. But gloves in and of itself, just like your hands, I mean, it helps protect your hands and keeps your hands clean. The problem is your gloves will be exposed, and it gets exposed the minute that you touch a surface. So, you know, if you're an individual that works in an office and you know nobody touches your surface, your keyboard, your laptop, your workstation area, you know, I think there's going to be less of a need to wear a glove. It's your setting you're familiar with, your workstation, your surfaces. You do your own cleaning and disinfecting. I think a need for gloves there is probably, that's not zero, but hey, you know, I think there's less of a need to do that. But if you know you're going to be out in a workstation area that requires high flow with a lot of exposure to people, at least where I work, where we have people coming in and out, we're cleaning, disinfecting almost every hour, every 2 hours. We're cleaning all surfaces. So, but to whether or not to wear gloves, even in that setting, I think if you're very aware of what's going on with your hands and what you touch, and what not to touch, and I mean your eyes, nose, and mouth, that could be just as effective. Just being very aware of what you're touching. As long as there's soap, water, or a hand sanitizer nearby, you will more than likely be repeatedly taking care of your hands on a regular basis. Even if you did wear gloves, everything you've touched, I mean, it gives a false sense of security that you're protecting yourself, but it actually is on your glove and can just be as risky as being just a bare hand.
Can you tell us what kind of gloves are effective, and maybe if there's a glove that we should avoid?
You know, I think any general glove, it would be helpful. I know there's like the food prep kind of gloves, the clear plastic kind of, that's good for a short term. If you know you're going to be short term of, you know, let's say, I don't know, maybe going to the store real quick and grabbing something, and, you know, that's pretty effective, but they're cheap and they tear and they rip. So gloves are pretty hard to come by right now if you're not in a healthcare setting. I've gone to stores, I've gone, you know, whether it be the supermarket or gone to Lowe's or Home Depot. I mean, you can't find gloves. I don't, if you're not in the health field, I really don't know where you're going to find gloves unless they're given to you by a health center. So they're pretty hard to come by right now. But even the food preparer gloves, those clear, oversized, I mean, that provides a level of protection.
I want to follow up with that. And if you could share with us, why is it that you begin each of our sessions with this kind of global kind of United States view and then moving towards our community of Milwaukee? I think a lot of us are familiar that we're a highly mobile population. Yep. But you know, why do you give us that kind of perspective?
I think it's important that we have context to what's going on. I mean, I could clearly just go focus right into what's going on in Milwaukee, but without having any context of what's going on, not only locally, but also regionally within the state or in Bemidji. It's important that everyone gets a sense of what's going on at every level. And that's really the public health approach, is when you look at not just internationally, but you look at nationally within the United States, and you start honing into what you really want to look at. So when you look at trends and you look at numbers, you want to look at context. You want to look at what's going on, not only in the world, but in the United States, what's going on in Phoenix, what's going on in Navajo, what's going on in Nashville. When it relates to Native people and communities, the resources to identify what's going on is so limited. It really is. And there's very few resources that actually are able to identify what's going on. So I could just skip right to the Native and talk from there, but that doesn't give you context unless you have something to compare with, not just side by side, but also nationally, what's going on with all the entire country and as well as to the entire world. So it really is to provide context and a basis for what we're seeing.
So Jeremiah, we'll go to you on any questions. I've lost my screen here, so I'm not seeing questions come in, but my follow-up on this one is I do appreciate that kind of global and narrowing the perspective. For our relatives that don't live in Milwaukee, when you talk about the south side of Milwaukee, could you share with us where most Native Americans live in the Milwaukee area?
I'm sorry for going through the screen real quick, but we're talking about the highway straight from Milwaukee out to Waukesha. It is south. It's basically the lower half of, if you're just literally to cut the city in half. We're talking about south of the highway. And so south side, and there's a south side and far south side. And so the largest, through census data, census tracking, and zip code verification, the largest population of natives in the city of Milwaukee reside on the south side. And I'm talking about the near south side. So you see where all those densely large yellow circles are? That's where the majority of natives reside in Milwaukee. I would say close to 32-35% of native live in that general vicinity. And that's why it's so important that I kind of hone in on these aspects. That's a good question.
Jeremiah, any questions on your side?
Yeah, I actually had a couple questions, all kind of relating to the same idea. Was if someone either wants to donate monetarily or gloves or food or meals or something for our elders, is there a more specific number or way to get in touch with us to go, kind of move forward and help kind of, maybe do what they can or do their part in assisting Glick and stemming, or curbing the spread of COVID?
Sure. So, I mean, we've had people from the community donate masks to us before, and we're more than happy to be able to not only accept those, but also distribute to them, especially the people who are at the neediest for those types of items. As far as monetary, that would be very gracious of anybody to do that. Although I'm not suggesting money, but even if it's other stuff, masks, gloves, even, believe it or not, clothes, even if it's food, we have that ability to distribute that to our elders as well. So as far as a general number to get a hold of us, 414-383-9526 as our general number. Please call that and ask for the administrative assistant, and we'd be more than happy to get this organized for any donations of whatever value or whatever item it may be.
Thank you, Dr. Ignace. So that's really at the end of our questions. Mark, I don't know if you have anything else you'd like to add?
Sorry, I do. Because we do get questions that come in that are not during our sessions. And I just wanted to follow up on a couple things is in that conversation about gloves and the conversation about kind of the masks. Is there a rate when we're using a mask that we should, okay, I need to not use this mask anymore? I mean, I know there's a range and gamut of masks, but in our native to native conversations, a lot of our relatives are making us the cloth masks, and then others are giving us the paper sort of mask. Can you kind of give us a general rule of thumb when it comes to type of mask? What's the longevity of that? Do we change them out midday? Do we kind of, what should we do?
So all masks aren't created equal. That is for sure. We have cloth masks. We have, masks that are made out of cotton or polyester. Those provides, some protection. And there are masks that are surgical or medical grade. Even those types of masks, and those are those kind of like the paperish looking ones that you see, people have been wearing. They can be white, light blue, or but you see them, they're kind of square, and you kind of have to spread them. And, so those are protective. And then you have higher medical grade ones like N95s. Those are the more form-fitting masks that you may see that are very odd-looking shape, but they're more, suction cup to your face looking. Those are the most protective. The problem is they're not reusable. So you could use an N95, you could use it for as long as it will handle whatever the day may be. But don't expect to be able to use it every day, every day, every day, every day. It will break down. Same with the surgical blue medical masks that you may see folks wearing as well. They're not meant for long term. They are short-term use. They're not made for repeated use. You could use it maybe up to 6-8 hours before it starts breaking down. The cloth masks that you see lots of folks wear, even just a bandana or a t-shirt, these are obviously washable and they're reusable. The surgical mask and the N95s tend not to be reusable, and they will break down, not just from a structural standpoint, but from just from a wear and tear. They don't last long term. I'd be surprised if you could use an N95 more than 48 hours before it just starts really breaking down. So the higher you go in terms of protection in masks, the less reusable they are versus a cloth mask or some type of covering, which is less protective, but obviously reusable and washable.
So we've been reading in the news a couple of weeks ago now, and then just this past week in Acknowledge That last program, a lot of our homes have pets, animals, cats and dogs, and we understand that they can acquire COVID-19. I believe that's right, if that's right. So I don't know if there's an answer, but it is a question that came our way. Is there a way to, what do you do with your dog? You let them outside, you let the cats wander, that kind of thing. Is there something we should be doing with our pets? Should we treat them like our kids? Do they wash them every time they're outside and running about? Do we get them little masks? It was meant in a joking way. And again, I just, guys, you can check in on the program. You don't have to text me to get in front of everybody to get your question. But I'm throwing that out there because it came across.
Yeah.
Got dogs. What do I do?
I think this really only comes into play when the owner of the house who has the pet, I think the owner, let's say they definitely have coronavirus. Once that is not only confirmed, but they also are symptomatic, CDC actually recommends to keep them separate because of that potential risk. Is it transmission 100% or 1%? I suspect it's fairly low. But if you have the means and the ability to have someone tend to your animals while you're recovering, that may be the best idea. If that means a kennel or a neighbor or family, maybe they tend to your pet for the next 14 days until you recover and get over your infection. So there's no right answer in this, but I think if you're looking to minimize that exposure as much as possible, maybe giving your pet to your friend or family friend or neighbor for a week or two may not be such a bad idea.
Kind of, we're coming down, so maybe the last couple questions. We've heard this reference to that the CDC recommends. When it comes to the workplace, does that carry the force of law? Like that person reports to work tomorrow or at some point next week and says, these are precautions, we're hoping you have them, these are CD recommendations. If that workplace isn't doing the CDC recommendations, is that recommendation law? Is the workplace supposed to be doing that by law?
No, it's not by law. It's recommended with guidance on how to support employees. So it's important. As far as I know, there is no mandated law in the country that says that you have to follow the CDC. It is highly recommended. It's strongly recommended that employers protect their employees as best as possible. So it's important that as an employer, that you do provide everything that you possibly can. Now, if that isn't possible, and what I mean by that, let's say masks. If you have a covering or a mask, I would look at bringing that to work. You will at least have a covering of yourself during working hours. As far as hands, you can always do the hand sanitizer and the washing, no eyes, nose, or mouth touching, that kind of thing. But if you're looking at minimizing, even bringing a cloth mask to minimize your risk or exposure, that would be at the very least you could do for yourself if your employer doesn't do it for you.
I know that another question that came in, gaming facilities are beginning to put in acrylic shields like some of our gas stations have. Is between, meaning the workers at their station, let's say it's a car dealer or it's and the customer, what is your impression on that being of any use in that kind of environment? It's closed, but there's a plastic shield there. What I'm saying, that maybe the workers behind the shield and it goes maybe a foot or two above their head and it goes maybe 18 inches on either side of them.
So I think instead of looking at this being the protection between persons, I think maybe it's a misnomer to call it that. I think at the very best, it could be a splash protector. And that really, what it is, when it really comes down to it, is a splash protector. So you had talked earlier about that 50-mile-per-hour cough or that 100-mile-per-hour sneeze. This is that kind of shield, that splash protective. That doesn't mean it can't go around, can't go over, can't go under, but we're talking about the direct exposure in that regard. If you're going to do that type of shield protection, you would have to do it from counter to the ceiling and all the way around you and have it sealed. And so it doesn't do that, but it does protect you from direct exposure, that direct spray, that direct splash of aerosolized droplets.
And one last question, just kind of a follow-up on that one. So when someone's coming into that place where someone just was, say a worker comes in and cleans that off, is there assurance that they've just taken care of the COVID-19 that's been splashed in that vicinity? I think we visited that one, that aerosol that COVID-19 can survive to a certain time, but this is, people feel secure when they see that kind of thing. Maybe they need to be thinking about something around that when they're approaching that screen after a line of people is in front of them.
So there are, EPA products that are out there that are germicidal, that are very effective in inactivating and destroying the virus. Some may take up to 30 seconds to 10 minutes. So there are products out there that you can use to disinfect and inactivate viruses on surfaces. They tend to be more medical grade germicidal surface cleaners. We certainly have them here in very effective in destroying either bacteria or viruses on surfaces. Very effective. So that would be certainly one way, and it really would depend on what type of solution companies or businesses are using. But again, this kind of goes back to this need to know your surroundings, know what you're going into, knowing what you're going to have to be in contact with, whether it's the door to open into the place, using your plastic to, pay for, in the punch thing, knowing where your fingers are, knowing where your hands are when you're in the grocery store, when you open up that freezer door and get your frozen pizza out for the night. You need to know what if you're going to use that hand, you be the hand that is designated to touch everything, and leave your other hand completely free of touch, so at least one hand is clean and the other one's dirty. So it's that kind of mental gymnastics that you have to, minefield that you have to, work through when you go in public. So it really is just being absolutely mindful of your surroundings, your surfaces, how you're going to manage one hand versus the other, and you just have to assume that everything where you go is the risk of contamination or the risk of that virus being present it's there. And not assume that it isn't. And you can't assume or trust that an employee, a business is going to clean that surface after, every 5 minutes. It's just not going to happen. So you just have to assume that it's everywhere, and you're going to have to be absolutely protective of yourself.
It is about 4:30 right now. And as usual, this kind of where I say for the folks that are tuning into our program, you're our thought leaders. You're the folks that have the ability to tune into a program like this, conscious to turn into this kind of program. Communicate the things that you're hearing. Please do that. And ask questions of the folks that depend on you for information. And I just, from myself, like to thank everybody for kind of taking a moment of their day, their week, their month to tune in right now. Because Wisconsin is now in record-setting territory with COVID-19, and that's going to continue. And for our tribal communities on reservations, it looks like they've been doing a great job. For those in urban areas, it's a lot more of us being on our own, and we need to pay attention to good advice. So Dr. Ignace, from me, thanks. Jeremiah, I'm going to turn it over to you, and then our last words can come from Dr. Ignace. And to those that I got 4 questions in the parking lot right now. We'll start with some of those questions when we get back together next week.
Thanks again, Mark. And just to kind of lead us out of this, just to remind everyone, we are streaming this Facebook Live, so you will be able to kind of rewatch this via Facebook. I will also be posting the full-length recorded presentation on our YouTube channel. And also just to kind of, get us into next week, there's been a lot of kind of commotion this week within Milwaukee County with one of our National Guard sites shutting down and one of them staying open. With, maybe not confusion necessarily, but just with all that's going on, I was wondering, just to take us out of here, Dr. Ignace, just remind people what Glick is here to offer, not only as far as testing, but just providing care to our community.
Sure. So thank you, guys. So Glick offers, we're a comprehensive primary care facility. So we offer adolescent, pediatric, OBGYN, adult ambulatory health services, primary care services. We offer dental, pharmacy services, physical therapy, behavioral health, aorta services as well. So we're very broad and be able to impact anybody's need for healthcare services. We can certainly offer that. So I do want to remind people that if there is a need for, we talk about face coverings and masks, we can certainly help people who are in need of these types of coverings. So if this is a need that you feel you or your family may need or want, please feel free to call us. We would certainly be able to offer on a limited time basis support in that way. As Mark was saying, as in the last 3 weeks, as I've been going through the Minnesota, Wisconsin, Michigan, the tribes of each of these states, they are doing exactly what they need to do. They need to look at prevention, protection of their tribal members, as they have been doing, and as they will moving forward. Absolutely, and they've been doing an awesome job. I also want to remind viewers that 70% of natives live in urban settings as well. So tribes from Minnesota, Michigan, and here in Wisconsin, if you know you have tribal members that are in urban settings or in the Milwaukee area, certainly let them know that they have a medical home that they can rely on, that they could call us, even if it's in a time of this need of coronavirus or need to be tested or assessed or evaluated. We can offer that. But on top of that, if they need a primary care facility to attend to their health concerns, we are here for that as well. I'm maybe the CEO, but I am also an internal medicine doctor as well, and I still see patients. So I wear 2 hats, multiple hats on every other day, but I do see patients, and I see them on a regular basis. So we offer a full spectrum of care, and so with that, I do want to message that even though there are tribes that are not reporting out of cases, which is great, it's here. It's without a doubt here, and there may be a delay between now and maybe 2 weeks from now or 3 weeks from now or 4 weeks from now, it is that first case, or that second case, or that 5th case, 12th case. This virus is contagious. It is transmissible fairly easy, and it can go through families and impact households and impact the family on multiple levels. And I just want to say how important it is to protect not only yourself, but also protect your family members, and especially your elders. We are a population that is young. Majority of our population is less than 40, and every tribe has their elders, and our elders are becoming fewer and fewer. These are the individuals that not only hold our cultures and our tradition and our language, but it's important that we also not only pay them the respect as elders duly are given, but it's important that we maintain their health and their safety as well. And it's going to be important moving forward that we protect our elders and protect our individuals and family members that may be at high risk. These are the people that we need to really help support and protect, certainly at this time in this pandemic. So everyone, do your part and protect yourself and your family. Thank you.